Hello, I'm Dr. Tess Laurie, and welcome to Tess Talks. Today, I'm speaking to Dr. Kat Lindley. Kat is a Croatian-born, American-trained, board-certified physician with a direct primary care practice in Texas. Her passion has always been for helping people. She became a family doctor because she loved the idea of taking care of the whole family and seeing the family grow. And more recently in her career, she's become interested in helping finding solutions to broken healthcare systems. Kat is involved in many medical organizations, including the American Academy of Physicians and Surgeons, and is also on the steering committee of World Council for Health. Welcome, Kat. It's wonderful to have you here today.
Thank you for having me.
It's really early where you are, isn't it?
Yeah, it's a little bit early and it's in Miami, so it's a little crazy right now.
Can you tell me a little bit about your background and why you became a doctor?
So I did not have a traditional route the way lots of American physicians have it. I was born in Croatia, in Yugoslavia, when it was a communist country. I left at 18 to escape the war that was starting, and then I lived in Italy and a little bit in England, and eventually came to the States. So I kind of had to grow up on the fly because I was very spoiled, sheltered young adult when I left. And I lived with different families, being their nanny, au pair, and things like that. So eventually, when I came to the States, I saved enough money to go to college, and I started. I always knew I wanted to do science, so I started with biology, and I have a degree in biology with emphasis on microbiology. And while I was studying one day with one of the children that I was taking care of, his dad, who is ophthalmologist, walked in and he said, "Why don't you become a doctor?" And it was kind of like a light bulb went on my head, and I was like, "Yeah, why don't I?" Here in the United States, lots of people will say, "Oh, I knew from the beginning I'm going to be a doctor." For me, it was different because growing up in communism, if you're not kind of stirred towards that profession or something, you will not become a physician. So it's not something like you can wake up one day and say you'll be. So it was really kind of one of those aha moments. Why don't I do it? And I applied and I got into medical school. But it made sense because ever from a young age, I was one of those that took care of the others. So it only made sense at the end.
Now, you've got quite an unusual approach to medicine, and I'd like to hear a little bit more about it.
I think because of my Mediterranean roots, I was always very grounded to home, to family. And you will get it because in Europe, we all have like old wives' tales. And like when I'm sick, my family calls me, "Did you make chicken noodle soup? We actually do something with milk where you make caramel with sugar and then you add milk to it, and that's supposed to cure it all, no matter what you have." So I kind of always had that, in my background. And then when I became a physician, I went the osteopathic medicine route. In the United States, osteopathic medicine has exactly the same degree as allopathic medicine. The only difference is that we also do musculoskeletal manipulations, similar to what chiropractors and physical therapists do. But from day one, we approach medicine, body, mind, and spirit. It's always in harmony. You can't take care of one if you don't take care of the other. So I had that throughout my medical school. And then as I became independent family physician with my training, it took me a while to get to who I am and where I am, but I've started to realize after 14 years of practice that no matter what I do, it's not really up to me. It's up to the person on the other side of the table. They have to make the decision, take care of themselves. So the way I think about medicine now is the actual physician is the patient, is the person who is involved in this care. I am just a guide. I'm just there to give them direction, to help them along the way, to encourage them, because when you think about it, and I think these past 2 years have shown us this, the 80% of what needs to be done is really patients need to do the job on their own, because you are and I am what I eat, what I drink, what I do, if I exercise, if I don't, if I move, if I just stress around all the time, if I don't sleep well, all of those things will affect my overall health. And it can manifest as a disease depending what's affecting us. So I truly believe that the healer is really the person and not the physician.
Thanks. Yeah. What does your practice look like? Is it? I believe you practice from home. How does that work?
So I actually do have an office. It's my office is actually very interesting as well. It's a little house, and when you walk in, it's a living room, and there is my guitar and some weights and things like that, with this comfortable couch and chairs. And there's a little kitchen area for if someone needs anything, and then you can go into a separate room that's really kind of the examining room, and even that is very simple. So I do something called direct primary care. And direct primary care, I am outside of the insurance network. I don't take insurance. Patients pay monthly membership fee that's very affordable. So I cannot change this into pounds, but it's $25 for children, 50 or 75 for adults, depending on their age. And that's really affordable for families because they can call me anytime. I was in England last year for 12 days, and I was able to take care of all of my patients the whole time. They have access to me. They call my cell phone. If I think anything needs to be done, I do it over the phone. If I think something extra needs to be done, there's always an option to go to urgent care or anything like that. But it's very nice because I know the patient. I know exactly what's going on. They can text me a few words, and I'll give them direction. And no matter what time it is, they can call me. But nicely, really, people always say, like, you work all the time. I don't. Patients are very aware that my time matters as well, and their time matters. And there is a respect when there is a relationship where we trust each other. There's always respect. So I'm not worried about it. And I can do my job from anywhere. I'm in Miami today for a meeting, and my patients, they will text me if they need me. I'll take care of it. If I'll call them, I can always do video Zoom. And then when I get home in a few days, if I feel like I need to see them in person and do any kind of testing, I'll do it then.
It sounds amazing, and you would think that you'd be just overwhelmed because you would have so many people to take care of. But that doesn't seem to be the case. Whenever I've spoken with you, you've seemed very balanced, and you seem to be one of those doctors who has a really good work-home balance. You've said that people don't abuse it, but I would think, how do you put a limit on the number of families that you then support?
I haven't done it yet. I don't know if I should. I'm really comfortable where I'm at. So usually the way direct primary care works, you can build whatever you want. The reason I love it is because it's whatever I want it to be. And I have a friend who's here with me today. She does it her way. I don't have a nurse. I don't have a medical assistant. It's just me and the patient, and I'm comfortable with that. So usually if a new patient who is not used to me, they'll call, and all the calls go into my cell phone. So I'm not sure, who's calling. So I just say hello. And they're like, is this Dr. Lindley? I'm like, yep, it's me. I just like it that way. And I've never refused a patient. I don't think I ever will. And if I do become, a little bit overwhelmed, I have too many patients, I'll see if I can hire help to help me. But I feel that right now it's really hard to find doctors that patients trust. And I'm not overwhelmed. I have 5 children. I know how to multitask. While I'm on a Zoom call with someone, if someone texts me, I'll look at my phone, kind of make sure it's not an emergency. If it is an emergency, I'll take care of it. If it's not, I'll just kind of text while we're talking, say I'll come back. It's just really about priorities. I think if you set your mind to it, you can do anything. And I'm a firm believer that we really can do anything.
I think for many people, it'll be a complete surprise to hear that you don't have insurance, because most doctors are absolutely terrified of litigation. It can be so time consuming and unnecessary. And in many countries, especially in the US, we're very aware of the high rates of litigation. And there's generally quite a blame culture, isn't there? If something doesn't work or goes wrong, people are encouraged quite actively to blame the physician or others in order to get compensation for whatever. And certainly part of the work I'm doing is to try and teach people that in actual fact, life's a journey and there are all sorts of things that happen to us along the way, and we need to learn through these difficulties rather than be looking for someone to blame for our circumstances. But what do you think in terms of litigation and mediation? How can one reduce the blame culture?
So I do carry malpractice insurance for my practice. I think we have to for each of our states, but because it's a primary care office, it's less than other specialties. But I don't take insurance that patient has. We have the transaction that's only cash a transaction. And I apologize for a rooster in the background. It's Miami. But I do agree with you about litigation. The reason I'm not really worried about it because of the relationship I have with the patient. They know they can reach out to me anytime. I think in the United States right now, the current medical environment is you come to the office, you go, you have lots of gatekeepers to get to the physician. Physicians are stressed out because they're seeing a lot of patients, they're doing the EMR, they're not building these personal relationships. Most of my patients don't call me Dr. Lindley. At most they'll call me Dr. Kat. And I'm totally fine with that, because to get back to who we are as physicians, I think we need to remember the medicine of the past. And I don't speak about technology side and all that, all these new innovations. Sure, there is always place for that to bring it in, but it's all about relationships. And it's not about the computer. I have EMR system because we are required to have it, but I don't use it while I'm seeing the patient. I go in, we talk, they leave, I write my note, and that's it. But right now, and I don't have as many requirements in my note because I'm not taking the insurance. But here, if you're taking insurance, you have to click a lot of boxes. A lot of physicians are doing that as they're seeing the patient. When you do that, when you are typing while you're looking at someone and trying to have a conversation, they know that you're disconnected. They know that half of your brain is on this task. And I think the litigation comes in because the patient doesn't feel safe. They have no relationship. But if someone with me, like if they're upset or anything, probably need to find some wood to knock on. I would expect them to come to me and just tell me, you know what, I didn't like the way you said that. Can we go back and redo it? Like I said, it hasn't happened and hopefully it won't. But it's all about relationship, communication. And I think that's why my practice works, and that's why I'm not stressed out, because my patients are really part of my family.
I've also got builders out the back here, so forgive the hammering. In the UK, we often get just 10 minutes with our GPs, so the slots are sort of 10 minutes apart, and we get to see different GPs, often not the same. So it is difficult to build that relationship, and also difficult to explain everything that's wrong with you or that feels not quite right. When you go and see somebody, you have to have a limited number of symptoms to complain about. Do you put a time limit on your consultations? And what is the sort of average length of a consultation when you're seeing somebody in person and on Zoom?
I tend to be kind of a fast person, but I don't put a limit, I just tell them to come at a certain time. And that's kind of what I was telling you about my office. I do have an office, but I'm not there all the time. I only go in when I make appointments. because there's no point of me sitting there wasting my time. Like I said, I have children, so I'll go to kids events, sports events, or whatever. So, and also my schedule is really weird. I had one time I saw a patient at 11 o'clock at night. And to tell you a little bit about me, and I hope you guys appreciate this noise because this is my life. The noise, the rooster, that's how I work. I think we are so caught up in being in these boxes. We think everything has to be right appropriate. I don't wear a white coat. I hate the white coat. White coat doesn't mean anything to me. White coat is not who I am. So that's another thing I don't do. But my favorite patient story is it was 11 o'clock at night Saturday. I was watching Avengers because I'm a huge Marvel fan. And the patient texted me and she was saying, I think I have a urinary tract infection. And I'm like a fatalist in some things. So I'm looking at it and I'm like, should I ignore this? Should I do something about it? And then I'm like, and in my head is like, if I ignore it, she's gonna have pyelonephritis. She's gonna end up in a hospital. And pyelonephritis is like an infection of, that goes all the way to the kidneys and all that. She's gonna end up in a hospital. I'm gonna have to go see her. She's gonna be on IV. So I'm like being so dramatic, and she's a young, lady. So none of this will happen. So I convinced myself that it's really urgent. I have to go see her. But I was really lazy, so I texted her back and I'm like, I'll come to see you if I can come in my pajamas. And she texted me back. She's like, well, I'm in my pajamas too. And I think, you kind of have to have a little bit of fun in medicine. And there's no limit in how long a person has to tell you what's wrong with them. Sometimes, I'll spend 20, 30 minutes and they're telling me this and this and that, and they're about to leave, and that's when they really tell me what's wrong. You can't put a limit to that. So I don't limit patients, and I know certain ones that take a little bit extra time, so I'll give them a little more extra time. In general, I'll do like 30-minute appointments just because in 30 minutes I can really do a lot. But sometimes if I know that someone else is coming, I might give them a little time. But it has to be about connection. It has to be about a person. It cannot be about our time limits, about the tasks we have to do, how many patients we have to see. And my panel right now, it's about almost 900 patients. So for direct primary care practice, that's a lot. Direct primary care practice is kind of cap at 600 because that's where you're comfortable. If you go above 600, it gets a little bit crazy. But the reason I can do 900 is because, like I said, patients don't abuse my time. They call me. I do a lot of stuff on the phone, so that's why I'm able to not have to see them all in my office. So I haven't capped yet, and I really don't think I will. I feel like this is who I am. This is how I can give back, and making someone comfortable, especially right now when they don't trust physicians. In the United States, a lot of people will say, even if they have something where they have to go to the hospital unrelated to COVID or anything else, they'll say, I don't want to go. I'm too afraid. I'm scared. I don't trust them. We have lost a trust that it's going to take years, maybe decades to really, really, truly get back. And I think the only way we will get it back is if we become people. There's nothing special about me. I just have a medical degree. I'm not different from anyone else that has a job. And I think we all need to realize that we're just people like everyone else. And the most important thing we can do is have a relationship with someone and make them feel comfortable. Because when you come to see a doctor, that's when you're at your most vulnerable. And sometimes it's hard to tell the person you've never met what's wrong with you. But in the days of old, especially in the United States with small town docs, and it was all about, doctor would come to their house, have a coffee, and then while they're having coffee, they will tell them what's wrong. And it wasn't about the setting, it was about that relationship between them.
Mm. Yeah, you've mentioned that the trust is broken down. And what do you think, given that, is the future of medicine?
So I do have lots of friends in UK. So for you guys, it's a little bit different. But I really think that I don't know too much about the NHS system. I just know a little bit about it, kind of based on what I know from the system we had in Yugoslavia and Croatia. And all I know is that medicine is easy. healthcare is a business. And I believe NHS has become the same way for you guys, the same way it has become here for us with Medicare, Medicaid, and commercial insurances. The system is broken. It doesn't matter which country you're in, the system is broken because it's not about, it should be about the person that's coming to see the doctor, but it's not about that person. It's about everyone else, everyone behind them. It's all about protocols. As a physician, sometimes I'll see something and sure, I have an idea of what I need to do, but I have to, yeah, sorry for the noise. I have to change. There's no protocol. I would say it's a little bit like cooking. You have a recipe that you follow, but you taste the recipe and you go along and you're like, it needs a little bit of salt, it needs a little bit of pepper, it needs a little bit of that. And that's how it is. So we have to step away from the system and protocols and numbers and machines and go back to being humans. That's the only way we will save the system. And I don't know that I can encourage the doctors in England and in UK to really, I would say, look deep in your heart. Look deep into your heart and decide, why did you become a physician? Did you become a physician to be employed by someone and just to treat people like numbers? Or did you become a physician to change the world and help someone? If it's that second choice, then step outside the box. Just do it. And do it with courage and do it that knowing that if you do it, they will follow. It's almost like that movie about baseball, build it and they will follow. It's truly like that because the system right now is broken. No one is trusting the physicians. We have a lot of people who are injured and no one is listening to them because the system is not allowing them. And people always say to me, I see a lot of memes, a lot of stuff about doctors being bad, but I truly know that inside they're good people. They're just shackled by the system the way it is, by the rules of engagement, as I like to call them. And I think if we reminded them all why they went into medicine, it would be like chains are broken and I can do anything right now.
Yeah, so true. You mentioned the injured, and I presume you're talking about those injured by the COVID vaccines. Are you offering treatment specifically for people who are injured, and what sort of treatment is that?
So COVID has shown us that you have to think outside the box. And when we just started with the COVID illness itself, physicians started with different medications and kind of tailored the treatment as we went along. And as we got different strains, the treatment changed a little. But the important thing is we have a lot of tools in our box to take care of this. So now we are dealing with long COVID syndromes or vaccine injured patients. The most important thing for them, especially the vaccine injured, is to be heard. No one is listening to them. So sometimes even just holding their hand and saying, I hear you, is like the first step towards recovery. And it gives them hope, it gives them courage to go on. Now, when it comes specifically to the treatment, it's very similar, kind of the way we did with COVID. You can use different medications. Specifically, ivermectin seems to work really well on a COVID injury. Steroids, high dose steroids, sometimes you can do a little bit lower. Antihistamines. There's really a whole list. There's a lot of people who have blood clots or D-dimers. So that means that they could develop blood clots. You have to put them on some kind of thinning medications like aspirin, or we have Eliquis. I'm sure you guys call it something else, but it's pretty much similar medicine. So you just have to look at the patients, look at their symptoms, and tailor that recipe for them. Lots of times people come in very fatigued. They really can't function mentally. They're very sleepy and they're achy and all that. If you draw some labs, you'll realize that their EBV titers are very high. So you can treat the reactivation of Epstein-Barr virus. Or they'll have herpes zoster shingles, which is very painful rash. So you have to treat that as well. There are a lot of modalities. I'm actually starting, like I said, I'm a little bit I don't call myself a weird doctor, but I like to learn. I really like to learn. I think there's no limitation to what we can learn. So I'm not really great with these new modalities, but I want to learn them. And vibration seems to work really well. This frequency works well. Um, I've heard of chelation therapies they're doing in Europe. I think Goldic is one treatment. I don't really know much about it, but I have a lot of people from UK who will find me somehow and text me, what do I do? And like I said, I've become friends with a lot of them because sometimes you just need to talk to someone. And what we don't realize, nature around us has lots of answers. Pine needle tea seems to work really well. Uh, and there are different formulations you can buy. There's also, even just vitamin D levels are extremely important. So you have to make sure your vitamin D level is high. You're taking it, lots of vitamins, magnesium, selenium, apopectin, Jones wort, St. John's wort, different things. So there's a whole list of things to do. And what I always recommend people is find someone who can help you. I know there's not as many physicians, but I think they're realizing that
Kat, we lost you a little bit there with the wind. Perhaps if you could just repeat the last sentence or two.
Yes, I was just saying there's a lot of nutraceuticals that will help us. So I think it's very important to look at that list because it's something that everyone can buy, and overall it's going to make us feel well. And there are a lot more and more physicians here in the United States and UK who are starting to learn and treat patients. And I think it's very important to look at different lists. FLCCC has one. Different places have different ones, but the protocol is very simple and it's very similar to the way we treat COVID.
So, Kat, a lot of doctors seem to not really know too much about the other types of healing modalities. And certainly there often seems to be a kind of a block about learning about them or referring their patients to them. And I guess it's because if you don't know anything about chiropractic therapy or homeopathy or any one of naturopathy and any of these other modalities, one doesn't really trust them. So how do you have a network that you refer to of integrative healers, and what is your approach to other sorts of healers?
I think we reached the point in medicine when we have to embrace it all. And I mentioned before, I'm osteopathic family physician. In the United States, osteopathic degree is different. So I learn everything my allopathic friends learn, same classes, we do same rotations, everything's the same. But we do this manipulation and we do it from day one. What we have learned with Andrew Steele, who was the founder, he found that people, if they have heart issues, they'll have some changes in their T1 to T5, the thoracic 1 to thoracic 5 vertebra. Well, they have maybe a rotation, maybe they have some skin changes there and things like that. Now, I can't fix the heart by doing manipulation, but I can ease some of their symptoms. So it's always good to look at what does actual musculoskeletal system and innervation do. So from the beginning, I kind of started looking at this differently because I realized that it's not the heart. It's not just cardiovascular disease. It's what else is going on with this patient. It's their diet, it's their sleep and stuff like that. And it's these musculoskeletal changes. So I've always been open to everything. And if my patient tells me I'm doing this and it's working, I'm all for it as long as it's not harming. Sometimes it's all in the mindset of the patient as well. And then as I evolved as a physician, I've realized that, traditional medicine is not the only answer. And I'm learning myself. I don't know much about vibration and frequency therapy, but I bought something. I have a chronic hip pain, for example. So I decided to try a little frequency cell because it's supposed to take away my pain. And I hate taking medications. I'm terrible at even taking antibiotics. And all you do is kind of tape this to the area where it hurts, and it did ease my pain. So why wouldn't I try something that's not invasive at all? And then homeopathy. How many years have we had homeopathy and it works? Hydration therapy, any of these things, they just help. So why wouldn't we do them? So I'm very open to learning more about it, and I think we need to embrace them, especially because patients have lost trust. It really just comes down to that. They don't trust us. We have to kind of look at the mirror and say, who are we as physicians if our patients cannot trust us because we're not listening and they're finding answers in naturopathic medicine in these different modalities. And why not embrace it with them and learn? Because I would prefer to do natural ways of treatment rather than take medications that even if it's helping me, still has side effects and it might affect me in a different way. And in all honesty, myself, I have lost faith in pharmaceutical companies. Last night we were all at dinner, different physicians, including Robert Malone, who has been in the vaccine industry forever. And we were just sitting down and saying, I have young children, and I'm like, I don't know if I can vaccinate them anymore. I have no idea. I'm afraid. And I'm a physician, right? I understand the science. I understand the MMR vaccine. I understand the measles vaccine and tetanus vaccine. And I was always all for it on time and do what you're supposed to. But now it's like my oldest has to get meningococcal vaccine. And I'm like, why do I have to give it to him? The study initially showed that only 15 children who were affected by the meningococcal disease, and we have approved this vaccine. What was the mechanism for approving it, and is it going to harm my child? And I think there's nothing wrong with asking those questions. We're all, moms, dads, grandparents, and we just need to kind of rethink the way medicine is going forward and say, is this the right path we're on?
Mm. I've been really blessed to work with you on World Council for Health, on the steering committee. And I just wondered if you could just tell me what your experience has been and what you think the role of World Council for Health is going forward.
Paul Alexander is here saying hi. Not just waiting.
Hi, Paul.
Hey, how are you?
I'm fine, and you?
Not bad, thank you.
So they're all over there in that other building. They're having coffee.
Okay, I'm going to get some coffee.
Okay, see you soon. Yeah, we might actually, we've had so many people if wanting to come to the conference. We could probably have a whole other panel, if we, Zoe keeps saying to me, don't invite anybody more. But
I was with Paul and his wife, and they're looking forward to coming. So I don't know if they answer yes or no, but I know they want to come.
Okay, yeah, because we can't afford to pay for their trip. That's the thing.
I have the slide, so I send it to James Heckman, but I'll have Robert do it as well because that helps a lot more. So I'll have him send it to these other guys and see what happens.
Thanks. Yeah, if they came and they could do their whole thing on the.
I know that's what I'm trying to get them to do. So we'll see.
And launch their thing there. That would be great.
Yeah.
Yeah, I need to have a separate talk with you about that anyway. But anyway, where were we?
World Council.
Yes.
So now if you want.
Yes.
So it's been really an honor to be part of World Council for Health, especially, it kind of came about really organically, which is the best way. I wasn't expecting it. We made connections, and I was asked to be on the steering committee. And I love that we're working with different people from all over the world, because we tend to live in this little safe haven for us, and we think the world around us is exactly the same everywhere we are, and it's not. So learning from everyone what's happening in their part of the world, even learning medicine and the way they approach medicine has been eye-opening to me. And then I really enjoy different partners that come in, and sometimes, like I said, I'm learning, and I'm really open to learning, and hearing them say these things. It's really good to kind of have a reset and say, this is not the only way, and it's working for them, so why don't I try it? And I've kind of incorporated some of the things I've learned along the way. And the best thing is, it's really for the people. We always say from the people, for the people, but it truly is, because we're all just, children of the world, and seeing everyone from different countries. And one of my favorite things is if someone is speaking, I struggle with like Irish and Scottish accents sometimes, or like with Indian accents and stuff like that. But I love hearing them because I love music. So, and I find accents to be very musical. So sometimes during the meeting, I'll close my eyes to kind of tune into their accents, because that's the best thing. We're all different. And I just love being a part of an organization that's making a change and allowing everyone to be heard. Like I said before, because of what's been happening with this, we have this whole new group of people who are scared, who don't have anywhere to turn to, who don't know what to do because they feel abandoned by their families, by their physicians, by their friends. And a lot of them do turn into the World Council for advice or just to hear us speak about injuries and stuff like that. And that's what we're supposed to be. We're supposed to be a beacon of hope going forward, because our system as is broken. We have threats from all over the places with new treaties from WHO, from governments maybe discussing lockdowns again. And one thing I always tell everyone, as lockdowns have eased around the world, everyone is like, oh, this is over, we can breathe. I don't think so. I really think that we have a little bit of a break right now to maybe regroup, to reassess where we are. But I do fear that going forward, we're going to have more lockdowns, more pandemics, more dangers, and there's always going to be this threat of trying to create us into one world. And sure, we are one planet, but we are many worlds. We are many nations, many countries, many cultures, many people, many voices. And we need to stay that way, because that's what makes us unique.
Thank you, Kat. What a wonderful conversation.